quite standard practice to have a cushion here supporting the legs.
Sorry, I've got really bad psoriasis on my legs, so it's gross, but nothing will affect it, so don't worry.
That's absolutely
But
fine.
it is a bit grim.
That's
Sorry.
don't
It's going to be on
worry.
YouTube now.
So, Bjorn said he's got some psoriasis on his legs, which you will see. And psoriasis is not a contagious condition. So already there's an issue there. In the medical history, he would have told me about that. And that's where knowing pathologies comes in, because something can look startling if you haven't seen it before, but it's maybe not contagious. It's like eczema. It's not contagious. Okay, so we're going to start the massage. So the first thing I'm going to do in that position is tell the client what I'm about to do, because the client won't know. So I could say, I'm just going to move the towels around so that you're more comfortable. Okay, and I'll get my other towel. Is it that one?
No,
That one's great, thank you. So, I'll do it again, really slowly. I obviously did it too quickly. Okay, so I take both the towels. Nice firm hold. And we've got no clothes on. You can take bits up with you as you want. Okay. So I've taken the towel over the midline. So I now know that I'm above the top of the pants and not below it. So I can safely pull my towel out and know that I'm not going to expose my client. Okay, and I've tucked him in. So why would I tuck the towel in?
Protect the inner.
So protect his pants from the oils, but also to keep the towel in place and to give him some privacy, so he actually feels secure now that this part region of his body is covered. And then what am I going to do with this towel?
Turn it
Rotate it.
And why would I turn it around?
in case his arms are hanging down.
So has anybody got the possibility of treating a very tall client?
Yeah.
Yeah.
Because if you've got just a small towel, it's not going to be very easy to cover them. Okay. How does it feel, Bjorn? Do you feel cosy?
Mm-hmm.
Okay. So your client's in position. Okay, and so, what am I going to do next?
Stop.
What's that?
No, you're going to start.
Do the hold.
Okay, so I'm going to start with the massage. I'm not going to do the full
Yeah.
top of the body massage because you've done that already today. So I would start with my hold.
Hold.
Okay. It's a great opportunity to get to know your client. As George said, it's a sort of listening exercise, but you're listening as well with your hands, which is something when you do a lot of massage, you listen to the body with your hands, which is okay. So I've done my hold, and I'm going to do the gliding technique with the towel, which is nice. I don't need to tuck this towel in, because I've got the towel tucked in. And then I'm going to proceed with my massage, with my upper body massage, with my effleurage. What else have you done?
Petrissage.
Petrissage. Okay.
Side to side.
Do the full massage that I'm going to do in this area, and then I'm going to bring the towel back up again. Okay. And I might finish this area with a hold. Do you think there's a right way to move from one part of the body to the other?
No,
What do you think, Tidor?
I don't.
You think
With,
that there
with
is?
the hold,
You would use the hold in between when you moved.
yes.
Why would you do that?
To count the body
Okay.
and myself.
Okay.
And to connect it.
So it is a kind of connection, isn't it? You're saying to the patient, I've finished here, okay, and I'm going to work somewhere else. So then you can go to your next area. And what would you do when you got to the next area?
Folded the...
Would you fold it out, or would you say?
Do a hold.
So you could do a hold here, because also your patient can't see what's client can't see what's happening. So again, you're giving the same information where you are and what your intention is. And then what am I going to do?
Tell them that you're moving the towel.
Yeah.
So I'm going to carefully move the towel into the middle, and I'm going to tuck the towel.
Do you not let them know you're going to do that first?
I could use instructions. I could say I'm going to tuck the towel just here under your leg. But I think when you start doing it, it's better to have less leg exposed and be confident than to be a bit nervous and rumbly in this area. Because it's a slightly sensitive area, of course, because you've got the bottom and all the sort of genitalia issues of intimacy around this area. So it doesn't matter that we're not going to work right in that area. It's not appropriate. Okay, so we've got the whole lower limb exposed. So here we've got, from yesterday, what's this bone called?
Heel bone.
The heel bone. Anyone? Calcaneus, the heel bone. And the bones of this part of the leg?
Tibia and fibula.
Tibia and fibula. And which one's the smaller bone?
Fibula.
Small fib.
Fibula? What was that?
Small fib.
Small fib.
It's a small fib, it's a little line.
It's a little line. And how about the bone of the thigh? The femur. Okay. So they're the bones we've got, and the muscles you'll be doing later. So we've done the hold, and we're going to start with the massage. So what's the likelihood of the first stroke that we're going to use on the leg?
F1.
Okay. So, body posture first, a bit of thinking about it. Now when you're doing a limb, especially with your effleurage, there's several different ways of doing it. So you can start with your effleurage. What's the purpose of effleurage?
Warm the skin, warm the muscles, stimulate.
Warm, stimulate,
Move the blood,
and
move the fluid.
put the oil on. So you'll find with different areas of the body they require different levels of oil. With men's legs, where they've got hair, you will need more oil because you need to be able to move without pulling and pinching that hair. Is that okay, Bjorn? How's the pressure?
Fine, thank you.
Okay.
This is how you deal with the hairy person. Is you apply more.
You will need to, because if it's too dry, you end up actually pulling the hairs. But again, it's a feeling that you actually will get used to. Okay, so I'm just doing some effleurage strokes on the whole leg. Sorry, no, it's fine. Okay.
We're just talking about our hairy legs.
Hairy
Yes,
legs.
yeah, no, I'm glad I shaved yesterday.
No.
Yeah.
Women are always talking about their in terms of body posture, you're not using your arms much, so the pressure is all coming from your body. And what you don't want to do is overstretch, so you don't want to be going off into the distance. You can do a manageable stroke. If you can't reach all the way, you can always move your feet and work that area. There are no rules, as long as your strokes are rhythmical and full and flowing. So it's not about how long, it's the sensation of the stroke that's important, okay? So you've done some effleurage. There's different ways of doing effleurage. So you've got your flat hands. You could effleurage a particular area. So you could do the calf and then do a bit more on the thigh. You've got to make sure that the effleurage is covering the whole leg, not just the top, but think about the sides. See here, I immediately realised that I need a little bit more oil. So what I'm going to do, somebody actually asked the question in the homework, is I'm not going to take my hand off the leg. I'm going to put the oil into my other hand and so that the client knows where I am, and then carry on. Because actually on the sides, there wasn't enough oil. Okay? So don't be frightened to put more oil on, or put too much on at the beginning because you're worried about it. Any questions?
Are you
Fairly straightforward.
pushing the lymph up the body?
You are encouraging a flow of any fluids in the leg. You are stimulating blood, but there will be lymph. The lymph actually sits quite close to the top of near the skin. So by moving the skin, you will be moving lymph. Yes. So we've done some effleurage.
And you know the pressure, because the blood is going towards the heart.
Yeah.
So does that mean your reverse stroke should be less pressure? There should be less
By
pressure on
nature,
it?
when we work on the legs, we work up the body. Generally, you don't start and work down. Most of your strokes, we don't work with most falls down. But it's one of those things, you don't want to have all your strokes in one direction and nothing coming back down the leg. I had to say it's a bit of a grey area, but I would suggest that you work from the foot up. But to go in both directions is not. Am I right on that, draw? Would you
I'd
suggest?
say foot up. Really.
You go foot up.
Yeah. Now, if you go backward, just kind of empty-handed, just really stroking
Yeah.
downward. So when you go upward, is more with kind of force with
Yeah.
getting the fluid up, and then down just light.
Because there is a different issue in the lower extremities in terms of circulation, which you cover later in the course. So by nature, I didn't mention it earlier, but I am standing at the foot end and not the body end for my massage, because it's a kind of automatic thing. So thank you very much for that, Hassan. So we've done some effleurage, we've warmed up the skin. Now I might at this stage choose just to do some petrissage and work here on the calf. If I was concerned about my client's leg getting chilly, I could just take the towel down and recover that area. Or depending on the heat of the room, I could leave it there. Okay? So I've done some effleurage and I'm going to think about some petrissage. So can you think of some petrissage that I could do on this area?
Ringing.
Yeah, ringing.
So we've got the ringing, the side-to-side ringing on the muscle. Is the pressure okay, Bjorn?
Mhm.
Can I go a bit deeper?
Yeah.
Okay. So that's working a little bit deeper. So we've got side-to-side ringing. Anything else?
Figure of 8.
So you've got figure of 8, one hand, then the other. Okay. Anything else?
Could you do it like, you know, on the neck where we were just squeezing up?
So a
Yeah,
pinching.
Yeah.
Why do you do petrissage? What's the purpose of petrissage?
To move the muscle.
To move the muscle. So although they're the set techniques, and you'll learn all of them, there's no right way to go about petrissage. It's about feeling and moving the tissue. So on this muscle, for example, it's really nice to just pull it away from the bone. So kind of pulling, pinching kind of action. Can you see over there? Yeah? How does it feel, Bjorn?
Okay.
Is that good? Okay. Anything else I can do? Any other petrissage that we've done?
Could you do the knuckle thing that we done?
You could do knuckles. With knuckles, because it's a deeper stroke, if you start slowly, and then you can go deeper. Can I go deeper, Bjorn?
Yeah.
Okay. Is that too hard?
Nope, you can go.
Okay. So depending on the musculature of your client, you can go really very deep. With someone who's got very big, tight muscles, you might want to go deeper. If it was an old lady, you would be, you probably wouldn't use your knuckles, to be honest. So you work the calf. It's very nice to work the Achilles and go in here, lifting the leg. You can lift the leg. Okay. You can work with the muscle in this kind of position. How does that feel, Bjorn?
Good.
Is that okay?
Mm-hmm.
Okay. So pinching, pulling, and moving.
Does it, when it's flatter and when it's up, does it change the
It
tension
does.
of
It
the
does
muscle?
change the tension of the muscle. There's a very nice lift you can do where you hold the foot. Just trying to get my hand right, and wobble. Just wobble. Can you see? Wobbling the calf takes a bit of, but you're not actually. You're rotating it. Really. Rotating the ankle and wobbling this muscle. It's a different.
Just loosening.
Loosening. You've got finger petrissage where you're going in. That's really worthwhile doing because you really notice the difference in the tissue of that muscle and you can find tight areas. Okay. So there's strokes that you already know.
What about?
Heel of the hand. Yeah. Again, if you're going to use a bigger surface area, then you need to start slowly and then go deeper. And with the heel of the hand, you're going to use, what are you going to use? Your arm strength?
Your legs.
You're going to use your body strength to go in. Okay? So your position around the table How about working from the other side? You could try it, because the focus will be different if you're on the other side. So you might pull the leg from this side. Okay? I'm sure if you give your partners at home or family a leg massage, they'll be very happy. Okay? So, and back round again. So we'll just do this one again. So you're going to hold the foot and you're going to give that muscle a nice floppy shake. And then you could, if you want, carry on, get in there, feel of hand. Am I pulling the hairs, Bjorn? No. But you will need a bit more oil if you're massaging hairy legs. Okay. Now the new technique we've got today is tapotement. Another name for it is percussion. So the title of it itself will give you an idea. You've all seen it on telly probably. Tapotement is the massage technique that massage therapists are always doing in the movies, aren't they? So you've got several tapotement techniques. And what kind of stroke? We had some ideas of it earlier, didn't we? What kind of stroke do you think it is?
Stimulation.
It's a very stimulating technique. So if it's a stimulating technique, why would you use... Most of the techniques we've done are sort of fairly relaxing.
Is it to wake the muscles up rather than to relax, to sort of get them going?
So in the case of a fracture, where you've had a leg that hasn't been doing a lot of work and is a little bit, floppy and a bit lazy, it would be a great stroke to use. Why do you think it would invigorate the leg? What would it encourage?
Blood flow to that area.
Blood flow. So the nature of the stroke is sort of exciting the leg and bringing more blood in. So you've got several tapotements strokes. You've got cupping, so making your hands into cups. Okay. You've got hacking. So your hands for this are not rigid tight. They're a bit floppy and a bit flicky, really.
Your fingers
Yeah.
hit.
You can see the calf bouncing.
Yes. So you can see that the nature of the stroke is causing a different reaction in the muscle. Okay, so we've had, what was the first one?
Cupping.
Cupping. And again, it's degrees of strength that you do it on. You can do it over the towel, or you can do it without the towel. And they're a different nature. Which one feels better for you?
The cupping with the towel off.
With the towel off. And the hacking?
It's okay.
It's okay. Which one did you like best?
The cupping.
Cupping. Okay. Hacking. Pounding. What would pounding be? So pounding would be your fists. Again, start slowly, but you could actually go quite deep with this, depending on your client. How does it feel?
Not great.
Not great, that one. Too hard?
Yeah.
So I'd have to go more slowly, more gently with this stroke. How's that?
I just don't like it.
Don't like it. Tapotement is one thing that people do or don't like. Some people love it. Other people, they want to be lying there still and they don't like it. So it's really, a friend of mine who worked in the city used it a lot. She'd do a massage and always finish with tapotement. Why?
Stimulating the blood.
To stimulate, but why would she do it if she was doing a lunchtime massage?
To wake people up.
To wake their clients up after their relaxation so that they could start work again. Okay. So we've got cupping, hacking, pounding. Pounding is the bottom of the fist. Okay? Sorry, I didn't really like that, Bjorn.
That's all right.
But it's good feedback because whoever you work with will give you feedback on what they like and what they don't like. Pummeling is another one, but with a different part of your hand. Pummeling with the knuckles. And the last one is tapping. Some of these techniques you can use to a degree in head massage as well. Tapping is a tapotement that we often use on the head, not pounding. Okay, so that's the calf. Any questions? Anything anyone's unsure about?
No, just this one, massage used sometimes.
A flicky one, yeah, it's a flicking technique. It's not so different
Yeah, you
really
can
from the
hear that.
hacking.
I mean, I've never seen it.
Yeah, it's-
But from the back, you just like, all you hear is
Where did you hear
It's-
that one?
in Thai massage. You do it after.
It's a click. You actually make like a click
You
sound
sound
with your
like,
hand.
your
It's sort
hands
of,
going.
it's a bit in here.
Yeah.
A bit of a pop sound. You can perfect it.
Oh.
It's not something that I do.
Yeah.
But okay. So when you're doing the calf muscle, don't forget the Achilles area here at the back of the heel, because it's actually quite nice to have all of your leg massage, not just the muscles. The other thing you have to look out for is the back of the knee, because it's a sensitive area. So that when you're working, as you're using pressure, but you lighten up at the knee area. So when you're working on the whole leg, you take it all the way up, but this area you glide over. So you might be pushing down quite hard, loosen, and then hard again. There's no rule of thumb. It's quite nice with effleurage to do the whole leg first, and then maybe split up, because you can't do everything at once. Okay, so the thigh. So I'm tucking my towel in again. Good. Okay, and you're covered here. So the thigh, we're going to repeat what we've done on the calf. So we're going to do a bit of effleurage again. Ideally, you're going to go up and not stop exactly at the towel. You can go under the towel a little bit. If the buttock were exposed, you could go all the way up. But in this situation, it's not going to be as ideal. If you're at home, it might be that your client, you will be more exposed. But it's not doing this area of the body is not something you do on a first massage, because you need to have a bit of trust before you work in the buttock area. So we're working on the thigh. We've got our effleurage. How's the pressure, Bjorn? Is that okay? We've got a big set of muscles here. Does anybody know what they're called in the back of the legs? Hamstrings. And the opposing muscles in the front of the leg?
Quads.
The quads. Okay, so you look at those. So effleurage again, and you've got various forms of effleurage. Your figure of eight, your ringing, yeah, and petrissage. So all of the petrissage strokes again. So we've got, someone remind me, reinforced hands. That's quite nice on the leg. Knuckles. Again, start with a lower pressure. Some people have very tight areas in the legs, and the hamstrings, if you work very deep, can be very painful to work on. So your towel really denotes where you can work, and you're missing out a bit, but don't worry about that. You might want to change position. It's a bit hard for me because you've got much room at the end of the table, and work on this leg from the other side, because the direction of the muscle, if you're pulling and lifting the muscle, you'll be doing it from a different direction. Yeah? I'm not thinking about my posture, so I'm leaning over the table. So my legs should be in a better position. Your body will tell you when you're in the right position. You can't. The other one that's very nice is using your hand and doing a sort of lateral. Again, you've got to have a real issue with how much oil you've got. But you can use your hand, the heel of your hand, for pushing. Okay? Any questions?
When you're working on the thigh, as you've done it, you've split the calf from the thigh. Will you do that in a massage, or is it just for the demonstration? Like, if you're doing a massage, would you work on the whole leg at once, or just break it into sections like that?
I think with effleurage is a more general warming up stroke, but petrissage, you're really the devil's in the detail with petrissage. So it would be probably easier. You can't really do all of petrissage on the whole leg.
Okay.
It would be better to work in a small area
and then move on.
And do a bit in the. So things like the reinforced hands or the fingertips, the kind of rotation. You've done the small circles with your knuckles. You're really starting to examine the nature of the muscles underneath. How does that feel, Bjorn?
You can do it harder.
I can do it harder. I'm tentative after the tapotement, I'm not going to lie. Okay. But you're not going to go in hard anywhere around the knee, because there's nothing really, there's blood vessels here, not much protection. so that you can work on this whole area. Don't forget the side either. There's various tissues. Might do a bit of finger kneading into the side. You don't know these muscles yet, but you would. Anybody know what they're called on the side?
Abductors or adductors?
TFL.
TFL. So you've got tensor fascia lata. It's fascia. So this isn't actually muscle on the side, it's connective tissue. The iliotibial bands. But this is very nice to be worked. So don't, again, as with the shin, don't think that the thigh is only this bit on top. Okay?
Do the
You can work,
sides.
but tentatively, because people might be tight. Most people don't have their legs massaged very often. So, okay. So that's the thigh.
And are you reaching to the front at all? Like when I know you're saying to pay attention to the side. Are you just doing the side, or are you reaching over to the front at all?
If I wanted to do the front, I would do that separately. Yeah.
Okay.
But from both sides, you can work on that thigh.
Would you wait
And the other thing you can do is pushes. We haven't done pushes yet, maybe. But just using your weight.
Like a firm hold. Like
But just
Yes.
moving, you're still moving
Yeah.
the tissue. How does that feel, Gil? We're going to do a bit more on that as we go up to that. That's it. So, okay. Have you got enough to massage someone who's legged? Would you think you feel confident? So you've got the strokes that you know already, but it's a different shape.
You don't do the coupage on the...
And on the thigh, just the
side.
same. Do you want me to show you?
I mean, no, I'm just asking
Exactly the same. So what were the strokes? Let's just run through them. You've got
Cupping, hacking, pummeling, pounding.
and tapping. And
Can you also do that on the back?
that's cupping. Cupping, it makes a different noise. Tapotement you can do within reason anywhere on the body. I mean, the general areas would be the legs, the front of the legs too, and the back. I don't think you could do tapotement on the arms, but it's a smaller surface area. But yeah, you can do it anywhere. It's quite a nice one, so it's quite a nice change. People like it or not. So we've done the calf, we've done the thigh, and the last region to do is the buttock. So, and again, I'll reiterate, the buttock is not an area to do on some. And if you've got somebody fairly intimate to work on, but otherwise you should leave it for later. So do the leg first, and not necessarily just dive straight into the buttock. Okay. So if you're working with someone and you can't expose the buttock, you'll have to work over the towel. You're right.
Sorry, yeah.
Oh, bring your hand in. Well, you're not covered. You're not comfortable.
I'm scratching my nose.
Oh, okay, that's fine. Was the oil irritating you?
No, not at
Oh,
all.
well, that's good. Okay. So we're coming up to the buttock. So
That's more uncomfortable. Scratch his nose.
scratch his nose. Again, you could think about another hold here. If we get one of the skeletons, we could look at this region because it might be good to have a look at what we're actually working on, especially with the towel here. There's something that might be very useful to use here when we're working on the buttock, which would be, what would we use to find where to work on? If we're working above the towel.
Got the crest.
So when we come to doing the buttock, muscles,
Iliac crest.
okay,
On the crest.
we've just done the femur. Does anybody know what this area of the femur is called?
Acetabulum. Acetabulum. Acetabulum,
Right,
I think.
okay. I'm going to call it the great trochanter. Here is this protuberance, the protuberance from the femur here. And you can feel it on yourselves if you can feel the sticky out bit of your bone on your femur. Okay. So really, working on the buttock area, you're going to work over the towel from this bone from here to the sacrum. Okay, so it's actually quite a small area that you're going to be working. Can you see that? So from the great trochanter to the sacrum. And the muscles on the buttock run, how we say, laterally. They don't run straight, they run at an angle. Okay? And it's a very small area, so effleurage is not really going to happen, especially over a towel. It's going to be hard, but you could warm the area. So, but work to the buttock, especially over a towel, will involve less movement than we're used to, having a wide, bigger surface areas to work on. So really what you need to do when you start working is to find your bony landmarks. Okay, so I'm feeling here at the sacrum, and I can feel over here. So my prime area to work on is here. Okay, and I can start quite tentatively. I can do some palpation. I'm using the heel of my hand because it's less pokey than poking my finger or my thumb in. And actually this area can get very tight, so it can be uncomfortable and sensitive, which is another reason that you need to have a good working relationship with your client to work on. But really what you aim to do in this area is to move the tissue. You can't glide, you've got no oil, so you're using pushing techniques, and you can use a lot of body weight. How does that feel, Bjorn? Is it painful? No? Can I go harder?
Yeah.
Okay. These are very big muscles, so it's very good to work on them if you can. So I'm just pushing them. You could get your knuckles in and do a bit of rotation, getting into the muscle, moving the tissue. Tight there. I'm using quite a lot of body weight here. I'm not going to push him off the table. Okay. The other way you can approach the buttock is from the other side. So you can put your fingers around and lift the muscles and lift this area. And again, you might want to push away from you. Check with your clients in terms of sensitivity, using your fingers and your hand. Okay. Any questions?
Just the duration.
Duration. It's a very small area, so you're not going to. There are other techniques you can use in this area later. But it depends whether you are kind of working the whole region or you're doing this. If you're working over a towel in this area, you can't do work for very long. If you have more of the thigh and the buttock exposed, you could take your massage, your effleurage and everything up into the buttock. Because when we walk, we use our buttocks a lot, that action of the leg. So those muscles really do work with the legs. So it's great if you can massage somebody in this area, because there is a lot of tension in that area. So do you mind, Bjorn, if we expose a bit of your bottom? Not the whole of your bottom, some of your bottom. So again, with discretion, moving your towel, and then taking your towel in, you do it like this. And moving the pants back with the towel and exposing some of the buttock. You don't need to expose all of the buttock because we're really only going to work this area. So again, you can see now, this is where the trochanter is. I can feel it here, and the sacrum here, and you're going to work in this area. I don't actually need any more. It's a bit fiddly, depending on the pants that you've got to work with. But, you know, it's about you being confident, not being a big deal, not being perfect, and keeping your gravitas and relaxing and not making your client feel uncomfortable, because it won't be right the first time. It'll be a bit fiddly. So if you were working with the thigh, you could take your effleurage strokes all the way up into the buttock. Okay, so you're warming that region with effleurage. Okay. With the whole buttock. And you've got your range of effleurage strokes. You're working on your thigh, petrissage. You can take the petrissage up. What would be the rule of the thumb for the buttock in what we did over the towel?
Say it again.
The kind of rule of thumb, the general rule for working with the buttock as opposed to the thumb. Avoid the pokey finger thing, partly because of the area, but also because the muscles can be quite sensitive, so it's actually got more control if you work on a slightly bigger area, and it can feel very pokey. So using the heel of your hand and pushing, using your body weight, it's very nice. How does it feel, Bjorn?
That's fine. You can do it deeper.
I can do it deeper.
Can use
But you can't on everyone, because they will go, ow.
Also, I feel you can use the thumb, you know.
If you use the thumb in massage is a great tool, but it gets worn out very easily. So better if you're working with big muscles, not to use your thumb, and to actually use your knuckles or a bigger surface area, because your thumbs will wear out quicker than the rest of your hands if you use your thumb on its own. It's quite a vulnerable joint. Okay. But masseurs do use their thumbs a lot, but it's not ideal. That's not the way we'd like to teach it, is it, Drew, really? No. Okay, so getting into this area, I'm going to move around to the other side. Okay, and then you've got pushing the flesh away, and you've got pulling up and moving the tissue this way. This is quite nice actually, moving the tissue away from all the bones here. Using my heel of the hand a lot. You could do a bit of finger petrissage and feel the nature of the muscle. They feel quite different from the other muscles. Okay. Any more questions? Do you feel confident working on the buttock?
What if you have someone who is wearing, if you're working on like a man who's wearing the boxer briefs or both? Because you can pull them.
Up. Yeah, I mean boxer shorts, they usually tend to be quite baggy.
No, but I mean boxer briefs, the ones
so the
they're
tight
like
ones.
tight and to their thigh, because
They
a
are
lot
quite
of men wear them.
I mean, the
Is it? I mean, is it?
troubleshooting, to be honest, you could actually pull the pant down. You could pull the pant down this way if you've got cover. There's also that mode.
Oh, okay.
Okay, so if the pants are, if you're unable to get in, you can get in. But really, you want to expose the minimum of
Yeah.
their body when you do that region, because it will make them feel more relaxed if you don't expose the whole bottom.
Okay.
For all of us. Okay, and then, we'll finish with
A hold.
the hold. Okay, there is another move, which is a banging on the sacrum. It's not something I generally use, but it's quite nice, where you bang on the sacral bone. Have you done that one already?
No.
So it looks quite violent and aggressive, but the bone is really quite strong. How does it feel, Bjorn?
It's good.
But by banging on the bone, what would you be doing by banging on the bone?
Stimulating.
Checking someone in there.
Helping the blood supply around the bone and the attaching muscles.
So you are stimulating that area, and bones are stimulated by massage. You're not working directly on the bone, but the bone has blood sources, doesn't it? What's the covering of the bone called?
The periosteum.
So you're still having an effect on the blood flow in that area. Okay, so try that. See how hard you can go. It's a bone. Find your landmark before you do a punch on your partner's back, so that you make sure you get it in the right place. And then finish with a lovely hold. To tell your clients that you've finished. And someone asked in the homework if your client's asleep. Probably if you've done Tapotement, you've woken them up. So that may be that. Now that you know it, is a good way to wake a client up. With the Tapotement technique, I was watching some people last week. When you start Tapotement, start really, really lightly and build up. Because if you've been working in a very flowing, rhythmical way, and then suddenly you go, they'll go, what? Because it's like they've changed channel. So you do your nice flow, and then start gently and build it up. Okay? Okay, so with nice hold to finish. and off you go. So one person, change partners again, one person with the trousers and top half off. You're going to need to use 2 towels.
How do they get dressed afterwards then?
How do they get dressed? You've forgotten that. So they've got to get dressed. So how are they going to get dressed? They've got 2 towels on. Okay, they've got their pants on. I haven't taken the pants
underwear
off.
pants.
Okay. So I would check perhaps under the towel that my pants, if I've moved them, that they're in the right situation. So it's a reversal of the towel technique that we did. So I will turn this towel. This towel's actually in the right position, isn't it? So actually, I'm going to take out the towel from underneath. I can lift this a little. Take this towel out. Here. I mean, it's different if you've got a client at home, because as long as you free the towel, they can get up themselves. But here, and then you need to get up now, Bjorn. Would you like to move up and take the towel round them, and so that they're in control of the towel? Okay? With bigger towels, it's better. Are you okay?
Yeah, I'm just absolutely knackered.
And that's it, and everyone's just staring at you, and you feel like you're
And
just
you
waking
don't
up.
you cover it up then?